La restrizione calorica e l'attività fisica, in aggiunta alle terapie convenzionali, possono avere un impatto nel trattamento dei tumori? Noi l'abbiamo chiesto a un'esperta, la professoressa Christine Desmet dell'Università di Lovagno in Belgio, che abbiamo incontrato a Milano all'Istituto Nazionale dei Tumori, dove si sta svolgendo un convegno promosso dall'Accademia Nazionale di Medicina e organizzato dal professor Filippo De Bro e dal dottor Claudio Vernieri, dedicato alla relazione tra metabolismo e immunità nei tumori umani. Professor Desmet, which is the position of the American Society of Clinical Oncology regarding the role of diet, weight management, and physical exercise during cancer treatment?
Yes, so thank you. So actually the guidelines from ASCO were published in JCO in 2022 by Jennifer Ligibel. And actually they recommend actually exercise during cancer treatment to mitigate actually the side effects of treatments. However, so far there's not enough evidence in favor or against actually exercise or diet, any specific diet during cancer treatments on cancer outcomes. And they strongly recommend actually that further research and also especially randomized clinical trials need to be done to gather further evidence.
Your presentation today here in Milan was focused on breast cancer, specifically early stage triple negative breast cancer. But which are the current available evidences on the role of exercise and or diet in breast cancer?
So I think we can say that in triple-negative breast cancer patients, all these patients, they now get treated with preoperative, so neoadjuvant chemotherapy in combinations with immunotherapy. So far, there is no clinical evidence from ended clinical trials, but this is something that we are trying to answer with our trial, but also with other trials which are currently running, for example, here in Italy, the Breakfast 2 trial, or other trials in the world.
So, which are the open questions in this research area?
So I think that first we need to see which questions we want to answer. So we want to see whether actually exercise or diet interventions can have an impact on treatment efficacy. We want to see whether it can have an impact on the tolerability of the drugs, whether it can also have an impact on patient-reported outcomes. That's what we want to know. And we need to see specifically in this patient population also if there are differences, for example, in the early setting, that's what we want to see, or for example, in the metastatic setting, which we could expect could be different.
During your presentation today, you told us that you and your colleague have designed a study that is called Leslie study that aims to respond to an open question about the effect of diet and exercise on triple-negative breast cancer. So, which is this question? And would you tell us something more about this study?
Yes. So actually the Leslie trial is a trial that we aim to start later this year. And that will include different centers from Belgium, Luxembourg and France. And there in this trial we will focus specifically on patients with early triple-negative breast cancer. And it will be a randomized trial where patients will either be randomized to the control arm, which is the standard chemotherapy with immunotherapy, or the interventional arm, where they will have the standard treatment. But in addition, they will have 6 cycles of fasting mimicking diet, which will start just before the therapy administration, in combination actually with a supervised exercise, which is mainly endurance. And our first objective is really to see whether adding this lifestyle intervention would improve the response to treatment, and this based on the pathological complete response rate. But other objectives which are very important as well regard survival, regard quality of life, tolerability, and obviously, very importantly, we will be collecting a lot of samples during this trial so that we could also do a lot of different molecular analysis using state-of-the-art technologies to answer and to better understand how actually diet and exercise are acting in patients. Because so far, the largest body of evidence we have are from preclinical models.
So also a biological and translational study.
Yes.
And when will you have the first results?
So once the study has started, we expect an inclusion of 3 years. However, it is a neoadjuvant study, so we expect then the first results, let's say 4 years after the trial has begun.